Well, first of all, welcome, and thank you very much for staying at our hotel. We love our guests, and I hope it's been showing. If there are any challenges, you can let me know. Mr. Rosen is from the Lower East Side of Manhattan and came to Florida with nothing back in the 70s and purchased his first hotel right in the middle of the oil embargo in 1974 and went to his desk immediately afterwards and said, "Oh my gosh, what have I done? This is crazy." And he has since parlayed that one hotel into 9 hotels, all in the Orlando area. But first and foremost, just want to thank you for staying with us. You can't even begin to imagine how happy I am to be in a room filled with direct primary care docs. And that will become evident when you hear a little bit of my story, our story. We are convinced at Rosen that the direct primary care doc is the key, is the main component, the nucleus of what is going to fix the entire healthcare system. So thank you all for what you're doing. "27 years ago, Mr. Rosen was waiting for his renewal quote for his insurance, for our health insurance for our employees. And our claims experience was far, far less than our premium, so we were expecting a decrease in premium. It didn't happen. There was a significant increase, and we said, we don't understand. Our claims were a lot lower. And they said, well, your claims were good, but you're in this pool, and the pool's claims were not good. And Mr. Rosen said, well, I didn't even know I was in a pool, and I don't want to be in the pool. How do I get out of the pool? And they said, well, you have no choice. You have to be in the pool. And he goes, no, I have a choice, and I'm out. And so he opened up his on-site clinic, which is the Rosen Medical Center. It's right down the block here. And it had a doc, an MA, and a front office person. Once again, he was going, oh my gosh, what have we done? I don't know how to run one of these places. But we hired smart folks, and we started to become involved in the daily routines of the medical center, and used a lot of common sense and due diligence to evolve to where we are today. So we have about 60 employees at our on-site clinic. It takes care of our 6,000 employees and dependents. And our healthcare costs are 30 to 50% lower than what our identical demographic would experience in the traditional healthcare landscape. We save about $20 million a year. We've saved almost $400 million since we first started, and that money has been used to give back to the community. And I would just encourage you to read a little bit about Harris Rosen and giving back. But it's just interesting that healthcare has allowed him to do that. When healthcare costs are 30 to 50% less, you sometimes say, wow, you're sacrificing care. What's up? We're not. Our quality of care is tremendous. Our benefits for the employees are tremendous. It's a funny looking graph, right? It's this downward cost and this upward kind of benefits, and it's like your mother told you years ago. If it seems too good to be true kind of a thing, but it's real. It works, and it's kind of interesting if you just take care of folks and not let the other stuff get in your way. Great things will happen. And that's what we've experienced. There are no deductibles on our plan for our employees. There's no coinsurance. 90% of our drugs, no cost. What we constantly have been doing over the years, and listen, there are still areas where we kind of get a little humble slap to our forehead and go, oh my God, I can't believe we haven't kept our eye on the ball there. Boy, there's more savings there, more quality there. But our goal has been just to reduce the barriers to care, and so barriers can be costs, so we really reduce the cost to hardly nothing. For the employees. Another barrier is transportation. Some of our employees are riding buses to work and that sort of thing. And so we have a bunch of limos and taxis that are sitting out front, and a lot of times they're just kind of sitting there waiting on the next person. So if one of our folks needs to get care and they don't have transportation, we'll dispatch somebody to take them there. So lowering the barriers to care is huge. Everything that I'm talking about here may not work for every employer, okay? But we don't allow our employees to smoke. If you want to work at Rosen hotels, you can't smoke. We have a random drug test that includes nicotine, and so that we believe has helped some to keep our costs down. We have nutritionists, podiatrists, radiology, lab, pharmacy. We do Zumba, Tai Chi, spinning. No cost to any of that. We focus on hypertension and diabetes and cholesterol, and our compliance, and I can't speak to the compliance rates. I've got folks that are smarter than me that can do that, but our compliance rates on each of those is about twice the national average. And we attribute it to just having those low barriers to care. Folks feel comfortable coming in and letting us take care of them. We spend $3.5 trillion on health care, about 17% of the GDP. It's terribly broken. If we could just figure out a way to fix the system and let everybody know, if you take just a smidge of the healthcare dollar, but maybe a disproportionate percentage of the healthcare dollar, and you direct that toward primary care and give those primary care folks the tools that they need to take care of folks, the dividends are huge. The pharma comes down, the hospital comes down, the specialist comes down. It's just amazing. We think that, this is just a personal thought, we think that the way to fix things, and there's a lot of good disruption going on, we like that, and it will only get better, but we need to reduce the total cost of health care. If we can reduce the total cost of health care, everybody will get that care that they really, really need. And Washington is absolutely clueless, in our opinion. Whether you're red, blue, purple, they have been talking since 2010 about where to shift money. And to my knowledge, there has been not much weight given to reducing the total cost of health care. So our thought is that employers can fix this. Employers have a tremendous amount of collective leverage, and that is their employees who are on health care plans around this country. At the end of the day, it is the employer in America who pays for hospital, for big pharma, for specialists, for insurance. We, the employer, we are the consumer, not hospitals, they should not be dictating to us, not insurance companies, big pharma. We are the consumer, and we, not them, should dictate what we want. So, thanks. So healthcare is local. If we can fix it in Orlando, for example, we just replicate it and we can fix it elsewhere. We in this room know how to fix healthcare. You're doing it every day. But the C-suite at the employer does not understand how to fix healthcare. They're bright, talented people, but when they look at the second largest line item on their P&L, it hurts their head, and they have a big stack of things to do for the day, so they defer to their benefits administrator, and their benefits administrator, very talented, hardworking, is overwhelmed, and they defer to their broker, who has a perverse incentive to keep doing things the same old way, and we can't continue that. If we educate the C-suite on how to fix the system and get their buy-in to exercise this collective leverage that they have, all their employees, we will absolutely fix the system. So here's how we think. Here's a way to do it, we think. Harris Rosen is a very influential C-suite person in town, and we have him invite 49 other folks from the Central Florida area. And listen, this could be done in Atlanta, this could be done anywhere, but we get these 50 folks in the room, and we immerse them in an understanding of what the problem is. They will walk out of there within an hour and completely get it. We then ask them to commit to joining together to fix the system. We then have a press conference to bring attention to the problem. These employers agree to send a lot of their employees. Now, get a large number of employees down there, and we'll get some local and national attention. At the press conference, we expose all of the players who are messing things up for us. And we convey to these players that we're mad as hell and we're not going to take it anymore. Once the press release is done, we provide the C-suite with letters, template letters to send to, that hospital executive, that local pharma executive, that local, specialist group. And we basically tell them that we want to do business with them. They've got all the infrastructure out there, but we will replace them if they continue to misbehave. It's all of the players can be replaced. It's not rocket science. An employer group can create its own healthcare system. It is not that difficult. so we can create our own insurance company, hospital, specialist network, etc. But we'd rather not. We rather work with these folks. They've already got the infrastructure. When the healthcare system hears this message, I think things might be a little bit different. Now, and the content of the letter can say many things, but we think we eat the elephant one bite at a time. We start maybe small, and we say that we, the employers in Orlando, in Atlanta, in LA, demand that you increase quality by 10% over the next 2 years, and you decrease our cost by 10% over the next 2 years. The tough part is, and you all know this, the folks misbehaving have an almost unlimited supply of lobbying dollars. So this job for these 50 influential CEOs it's not for the meek. It will not be easy, and we will have to get out of our comfort zone. If we are not committed to getting out of our comfort zone, we're not going to accomplish this. But if we simply keep our eye on the ball and focus on fixing people, it will all get fixed. So that's all I have for you tonight. And thanks again for staying with us.